Good evening, everyone. Happy Tuesday. My name is Ador Mansat, and tonight we will talk about my Week 9 project. But first, I wanted to thank our professor, Dr. Jose Alejandro White, for his mentorship and guidance throughout our nursing field experience course study. This is a voiceover presentation, which is a collation of the evidence articles that I have retrieved about my Doctor of Nursing Practice capstone project topic. The evidences are presented in support of nursing standards and patient safety towards my DNP capstone project. In addition, this presentation offers an introduction to my capstone problem population of interest and describes the methods, data collection, and analysis proposed to conduct my DNP project. I shall also discuss my next steps as I move forward in my advanced field experience. And as I critique my weekly articles, I shall also explore the reasons for any similarities or differences within the evidences and discuss the strength of that evidence. In the end, my goal is to present and analyze how each evidence supports nursing standards and patient safety. So here goes. The goals of this Week 9 project clinical seminar is fourfold. One, demonstrate a clear relationship between the achievement of course and practicum objectives. Two, demonstrate the relationship between evidence and practicum experience. Three, use professional, easy to read formatting and follow rules for developing a Microsoft PowerPoint presentation with a voiceover PowerPoint presentation. And four, use correct spelling, grammar, and professional vocabulary, and citing all references and sources using the most recent 7th edition American Psychological Association or APA format with no errors. So the ethical principles and DNP practice combining semaglutide and IF or intermittent fasting and obesity management. Introduction. Today we are delving into the integration of innovative healthcare interventions, specifically the off-label use of semaglutide coupled with intermittent fasting or IF for obesity management. The promise of these interventions lies in their potential for significant advancement in patient care. However, such innovations are not without the need for thorough ethical scrutiny, especially within organizational settings. So, for our topic area, our focus is on the ethical principles that are pivotal in the clinical application of these treatments: beneficence, autonomy, and justice. These three ethical principles serve as the foundations for ethical decision making and practice in healthcare, guiding the DNP in providing care that is both effective and ethical. So, the question we're trying to answer here is in what ways can we ensure that the ethical principles of beneficence, autonomy, and justice are upheld when introducing the combined use of semaglutide and intermittent fasting for managing obesity? So, moving on to the next slide, on the significance of this question, it cannot be overstated. With the rising prevalence of obesity, the ethical administration of such intervention is paramount. As healthcare providers, we must weigh the potential benefits against the risks, ensuring that our interventions do more good than harm. For the overview of clinical practicum, the clinical practicum provides a real world setting to observe and evaluate the implementation of semaglutide and IF. The practicum facilitates the examination of the direct impact of these interventions on patient outcomes, highlighting the ethical implications of their use. And so let's go through the analysis of evidence. The evidence indicates that semaglutide, a GLP-1 receptor agonist, effectively induces weight loss and is commonly used off-label. Similarly, IHEP has garnered traction as a beneficial dietary approach for weight management. However, the combination of these two strategies introduces complex ethical considerations, particularly regarding beneficence. Autonomy requires that patients be fully informed about the interventions that they receive, ensuring that their right to make educated discussions about their healthcare are protected. Furthermore, justice demands equitable access to such innovative treatments, especially given the disproportionate impact of obesity on certain populations. So let's outline our next steps. So, moving forward, our next steps involve the development of comprehensive strategies to ensure that patients are well informed and able to provide informed consent. We must also strive for equitable access to these treatments and maintain open communications to uphold the trust between healthcare providers and patients. So, let's talk about bridging evidence and practice in obesity management. We begin by addressing the urgent challenge posed by the obesity epidemic in the United States. Our DNP Capstone project aims to pioneer a multidimensional approach to weight management and disease prevention by examining the off-label use of semaglutide in combination with intermittent fasting at Serenity Wellness Medicine Clinic. For the topic area, our discussion is rooted in the intersection of health promotion and disease prevention. By exploring innovative treatments like semaglutide and intermittent fasting, we align our research with both course objectives and practical experience gained through our clinical practicum. So the question we are answering here is central to our inquiry is understanding how the combination of semaglutide, a drug primarily used for the treatment of diabetes mellitus, and intermittent fasting contributes to effective obesity management and the broader implications for healthcare delivery systems. So, gauging the significance of this exploration is underscored by the rising rates of obesity and the subsequent need for effective evidence based interventions. These innovative approaches have the potential to significantly impact public health. Now, let's talk about the overview of the clinical practicum in regards to bridging evidence and practices in obesity management. My clinical practicum offers an invaluable opportunity to observe and engage with the real world application of these interventions. Under the mentorship of Dr. Heidi Regenas, MD, we are not only able to witness, but also we are able to assess the practical implications of combining semaglutide and IF in a clinical setting, and that has so much value. So, with regards to analysis of evidence, the literature provides a strong foundation for our study. Garvey and Associates in 2022 present compelling evidence of the weight loss benefits of semaglutide, while Basim et al. In 2022 highlight the broad health benefits of IF. However, both sources suggest a gap in research regarding the long-term effects and potential adverse impacts of these interventions when used in combination or in tandem. So the next phase of our project is to delve deeper into the synergistic potential between semaglutide and IF, ensuring that we can develop safe and effective clinical protocols. This requires rigorous testing and assessment to establish a clear understanding of the benefits and risks associated with this innovative treatment strategy. Okay, so let's move on to the topic that we discussed in week 4, integrating leadership acumen in DNP capstone projects. We delve into the application of organizational leadership evidence, or OLE, to my DNP capstone project, which is at the forefront of managing obesity through the off-label use of semaglutide combined with IF. So let's talk about our topic area, the integration of systems thinking and business acumen to address complex health issues within the healthcare system. And also, the question that we're answering in this week 4 is how can organizational leadership principles enhance the effectiveness of implementing semaglutide and IF in a clinical setting? So, leadership in healthcare is multifaceted, demanding skills that range from political to financial savvy, all within a system thinking framework. This presentation examines how a leader's skill set in both systems thinking and business acumen can be applied to the complex challenges of obesity management. So, an overview of clinical practicum under the guidance of Dr. Heidi Regenas, applying leadership skills to the real world application of semaglutide and IF for obesity management. So, let's look at the articles. So, we have the first article by McNabb et al. In 2020 provides a systems thinking perspective that is essential for recognizing the multifactorial nature of obesity, while the second article by Raffetti et al. Rafferty et al. In 2022 underscores the importance of understanding the economic and operational aspects of healthcare interventions. The combinations of these two perspectives equips a leader with the necessary tools to design and implement interventions that are both patient centered and systematically viable. So, as I continue to work under the mentorship of Dr. Heidi Reginas, the insights gained from these articles will be instrumental in developing a capstone project that is not only clinically effective but also organizationally and financially sound. So, by weaving together the principles of systems thinking with business acumen, the next steps we can lead innovative healthcare initiatives that are prepared to tackle the obesity epidemic, comprehensive and sustainable strategies. Okay, so that's what's next. So now in week 6, we delve into the pivotal role of informatics in healthcare, focusing on the meaningful use of technology in the treatment of obesity. The DNP Capstone Project at Serenity Wellness Medicine Clinic, supervised by Dr. Heidi Reginas, is at the intersection of evidence-based practice and advanced informatics, utilizing semaglutide and intermittent fasting to combat obesity. So, for the topic area, we're gonna discuss the convergence of informatics, data mining, and evidence-based practice in my DNP Capstone project. And the question we're answering here is how does the application of meaningful use principles impact the management of obesity through our capstone, DNP Capstone project? So the meaningful use involves 3 crucial steps: adoption of electronic health records or EHRs, enhancement of clinical processes, and improvement of health outcomes. This project aligns with these stages by ensuring accurate data capture and analysis of patient outcomes and treatment efficacy. The use of robust data mining techniques, as detailed by Coling et al. In 2021, is essential in discerning the patterns and outcomes of the semaglutide and IF treatment regimen. So the literature underscores the DNP's leadership in integrating meaningful use in clinical settings. So let's analyze the evidence. So the first is the evidence or literature review from Trout et al., which highlights the critical role of the Doctor of Nursing Practice or DNPs in aligning EHRs or electronic health records with federal directives. And also the second literature review or evidence is that from Booth and Associates in 2021. It's a scientific article that reinforced the necessity of data analysis in driving evidence-based practices. By applying meaningful use principles to our DNP project, we ensure comprehensive data collection and generate actionable insights. The EHRs track patient progress, support informed treatment customization, and facilitate engagement through technology. Central tenets of meaningful use, as stated by healthit.gov in 2023. So the next steps, and in conclusion, the application of meaningful use principles within the DNP project exemplifies the potential of informatics and data mining in enhancing patient care and outcomes. So this project is a testament to the transformative power of evidence-based informatics in advancing clinical leadership and healthcare delivery in the domain of obesity management. So the next step is to integrate this data-driven insights into our clinical practice. Okay, so moving on to week 7. Okay, so we're almost there. We focus on leveraging the National Database of Nursing Quality or NDNQI for quality improvement within our respective DNP Capstone project. In particular, our aim is to enhance patient care for obesity management. This is for my DNP Capstone project. Enhance patient care for obesity management through systematic efforts supported by the NDNQI data. And the topic area of this week's project is the innovative application of semaglutide and IF at 2 medical clinics, Restore Med Clinic in Newport Beach and Serenity Wellness Medicine Clinic in Ontario, California. So the question at hand is the role NDNQI can play in supporting this project through evidence-based quantity or quality improvement methods or QIM. Okay? So moving on, so it's important to stress that the significance of NDNQI in this context is its capacity to provide benchmarks against national standards, helping to measure and improve upon patient outcomes and safety. So the clinical practicum is an overview guided by Dr. Reginas, involves the practical application of NDNQI data to monitor and enhance the efficacy and safety of the treatment protocols. Okay? So the evidence analyzed outcomes from studies that highlight the benefits of using clinical data to improve patient safety and care quality, providing a strong foundation for the project's initiatives. The next steps involve a deeper integration of NDNQI into the project, employing it as a benchmarking tool to measure patient outcomes and guide QI strategies. Okay? So, and finally, moving on to week 8 of our course focus, um, on the role of interprofessional collaboration or IPC in enhancing the outcomes of my DNP capstone project. IPC is a crucial factor in healthcare, particularly when introducing innovative practices aimed at tracking complex health issues like obesity. So, our question here for this week 8 discussion is what IPC strategies can be implemented to overcome common challenges in the management of obesity with the off-label use of semaglutide in combination with intermittent fasting. So, the significance, the goal is to overcome challenges such as role confusion, communication barriers, and differing opinions in patient care. As part of the clinical practicum, as for an overview of that practicum, effective IPC under Dr. Heidi Regina's mentorship is vital to the success of the semaglutide and IF regimen by utilizing strategies that promote interprofessional collaboration or IPC, such as regular team meetings and conflict resolution protocols. The project aims to enhance the collaborative capacity of healthcare professionals. Okay? So let's just identify two relevant evidences there. So we have one from Reeves et al., a research which highlights the importance of IPC in improving healthcare outcomes, while there's another one from the Amor and Ondazan in 2005, a little bit outdated, which but at the same as Reeves et al., they emphasize the need for more clarity within healthcare teams. So to address these challenges, my project will incorporate structured communication tools like SBAR, situation assessment, and so this is like a handoff. It's a handoff tool, communication tool. We normally use, from one team or one shift to another. Um, and interprofessional workshops to foster mutual understanding and respect among team members. Okay, so in conclusion, IPC, um, and for the next step, IPC is a fundamental component of my DNP capstone project. It not only facilitates the successful implementation of innovative treatments, but also ensures that all healthcare team members work cohesively towards improving patient outcome. So this is the end of my 20 slides maximum for this week 9 project. So just to wrap up, the following are just the ancillary slides and are not part of the first 20 main presentation slides, because these remaining slides are only meant to serve to enumerate the references used by the previous 20 slides outlining each of the weekly discussion topics that um, um, i- um, that informs my respective DNP capstone project on the combined intervention of intermittent fasting with semaglutide for addressing the ongoing obesity epidemic. So this slide here shows the references for the discussion on ethical principles. Here are the references for the discussion on bridging evidence to practice. Here are the references for the discussion on integrating leadership acumen to our DNP capstone project. And here are the references for the discussion on advancing obesity management through the meaningful use of informatics. And here is the references for the discussion on driving QI or quality improvement in our DNP project. And finally, here are the references for that week 8 discussion on interprofessional collaboration. And here are some more references on interprofessional collaboration or IPC. Thank you so much for your attention, and for taking the time to listen to my PowerPoint presentation. I will be recording this to YouTube too, so it'll be easier for everyone to access and view the presentation with one click. So make it a wonderful day. Thank you so much.